So midostaurin is the first FLT3 inhibitor that will be available in the market, hopefully, during 2017. And this will be the result of an important study, a very international effort by more than 200 sites from 17 countries in the world, who have been working together in a trial, the ratified trial, in which the conventional chemotherapy for patients between 18 and 60 years old with anthracyclines and cytarabine was compared to the same schedule, but adding midostaurin during induction and consolidation, and in those patients who do not go to a transplant, also as maintenance during 1 year. This trial, which has been conducted during 8 years, it was started in 2008, has been able to recruit more than 3,000 patients for testing the presence of the mutation, and finally including more than 700 patients in the trial. And as a result, it has been observed that those patients who were in the FLT3 inhibitor arm had a significant improvement in overall survival, event-free survival, and disease-free survival. So, so it's an important advance in the field of AML, where it's very difficult to get an improvement in survival compared with the results obtained over the last 15 years. So this has been a major advance, and for sure in the future inhibiting FLT3 in patients with this mutation will become the standard of care for these patients, combined with chemotherapy. The trial included patients up to the age of 60, and there is room for investigating more on this agent by doing trials in patients above these years, both with intensive or non-intensive therapies. And there is also room for investigating whether the administration of FLT3 inhibitor midostaurin after transplant is improving even more the results obtained in the ratified trial. Also, it is possible to investigate an extension of the exposure to midostaurin in these patients with FLT3 mutation. And because it was relatively short, around 40 to 44 days overall in the trial, so it may be the patients may benefit also from an extended schedule. So I think that the midostaurin, as I mentioned, is an important development in this field. And of note, this agent provided improvement in survival both in patients with FLT3 ITD high allelic ratio and low allelic ratio, as well as in patients with the tyrosine kinase domain of FLT3. So it's really an important step forward, and for sure will be incorporated into the clinical practice.